My name is Dr. Greg McNamara. This message is about the importance of the COVID-19 vaccine. This message is brought to you by a partnership with Morrison County Public Health, CHI St. Gabriel's Health, the Minnesota Department of Health, along with the CDC. What is the COVID-19 vaccine? This is a vaccine designed to prevent diseases. COVID-19 vaccines tell your body how to recognize and fight the COVID-19 virus. The COVID-19 vaccines cannot give you COVID-19. The COVID-19 vaccines are very good at protecting you from COVID-19 disease. These types of vaccines have been studied for over 10 years and are felt to be very safe. If you do get sick with COVID-19 after being vaccinated, it is less likely that you will get very sick or have to go to the hospital. COVID-19 vaccines are considered safe and effective. Why should you get a COVID vaccine? CDC recommends getting the COVID-19 vaccine as soon as one is available to you. By doing so, you will protect yourself from COVID-19. The COVID-19 vaccine is a safer way to build protection than getting COVID-19 itself. COVID-19 can have serious, life-threatening complications, and there is no way to know how COVID-19 will affect you. If you get sick, you could spread the disease to friends, family, and others around you. It could also cause prolonged side effects, including a chronic cough and mental fogginess. The COVID-19 vaccine will help protect you by creating an antibody that will respond to the COVID virus. That way, you will not have to experience the COVID sickness, and the vaccine also protects you longer than if you get COVID itself. The COVID vaccine is a way of protecting your loved ones and neighbors. Getting vaccinated yourself helps to protect those people around you. This is especially important for people who are at increased risk for severe illness from COVID-19 that could be potentially deadly. By getting the vaccine, you are supporting your community and you are helping to keep businesses, schools, and other places open. It will also help to put an end to the pandemic. Vaccines work with your immune system, so it is ready to fight the virus if you are exposed. The combination of getting vaccinated and following the CDC's recommendations to protect yourself and others will offer the best protection from COVID-19. Stopping the pandemic requires using all the tools we have available. The sooner the pandemic is over, the sooner we will be able to get back into our normal lives. How to receive a COVID-19 vaccine. Beginning March 30th, anyone over the age of 16 or older is eligible for the vaccine in Minnesota. To find a vaccine near you, please utilize the vaccine connector at https://vaccineconnector.min.gov or reach out to your local healthcare provider, pharmacy, or public health department. The COVID vaccine is free to anyone, regardless of insurance status. After your vaccination, it is still up to all of us to protect ourselves and others by getting vaccinated and following recommendations to slow the spread of COVID-19. You are considered fully vaccinated 2 weeks after your final dose. If you have been fully vaccinated, there are many advantages. You can gather indoors with fully vaccinated people without having to wear a mask. You can attend small outdoor gatherings with vaccinated and unvaccinated people without wearing a mask. You can gather or conduct activities outdoors without wearing a mask, except in certain crowded settings or venues. If you travel in the United States, you do not need to get tested before or after travel or self-quarantine after travel if you have been fully vaccinated. Traveling internationally, you need to pay close attention to the requirements of your destination. You do not need to get tested before leaving the United States unless your destination requires it. You still need to show a negative test result or documentation of recovery from COVID-19 before boarding an international flight to the United States. You should still get tested 3 to 5 days after international travel, but you do not need to self-quarantine after arriving in the United States. Even after being fully vaccinated, it is important to follow these precautions. Continue to wear a mask when in certain scenarios, like visiting indoor public settings or gathering with unvaccinated people from more than one household. Wash your hands often. Stay home if you are sick, especially if you have been around someone who has COVID-19. Getting tested if you have symptoms. Take precautions when you travel and follow any requirements of your destination. Following specific guidelines from your workplace. We can all beat this COVID epidemic together if we all get vaccinated and follow the CDC guidelines. Thank you for your attention.